Welcome to the video history of the American College of Obstetricians and Gynecologists. We are very, very fortunate today to be able to interview Dr. Helen Barnes. Dr. Barnes, thank you very much for being with us today. We appreciate your willingness to come in and share your life with us.
You're very welcome.
Thank you. Let me begin, because I know our audience will be interested. Where were you born?
I was born at home by a granny midwife in Jackson, Mississippi, December the 9th, 1928.
I wasn't going to ask you your name. That's not the thing we do. But thank you for sharing that with us. And thank you for, I suspect home birth at that time was not uncommon.
That's correct. In Mississippi particularly, we had granny midwives that were sent out by the health department. And they had a minimum amount of training, but they had good training. And when you made arrangements to go to the health department, get their little training, then when you went into labor, you called them. And my mother did that, and lo and behold, the granny midwife came out, and I didn't weigh but about 4 pounds though, so I didn't know, and neither did my grandmother, whether or not I was going to make it. But she said, I had so much hair on me, she said she knew I had to make it.
Grandmothers are very knowledgeable people.
Yes, yes they are.
And where did you begin going to school?
There's a Catholic school in Jackson that's probably only about 15 minutes from where I lived on Blair Street. And it's called Holy Ghost Catholic School. And it was run by the Sisters of the Blessed Sacrament. And that order was founded by Catherine Drexel, who lived here in Philadelphia. But they had a school there, and they had another school at the Mother House in Philadelphia, and then they had a high school. But when everybody else took off to go to school in the morning, my grandmother said she'd look around and I'd be gone. So she knew that I had trotted along with everybody who went to school that day.
And when did you first decide you wanted to be a physician?
Oh dear, I decided I wanted to be a physician, and I cry every time I do this, so I ought not to do it. But when I was at Holy Providence, which is it was in Cornwall Heights, Pennsylvania. It is now called something else. I was sort of irascible, if you understand and get my meaning. And so I was either in the laundry doing something with Sister Philippa, or I was in the infirmary. And there was a little boy that was always sick, always sick. But since I was always bad and was in the infirmary, I was always in there reading to him or helping him with his homework or doing something. And when James died at age 9, I told Sister Rosa I was going to be a doctor. So the next time James got sick, he wouldn't die.
It's awful very hard to take care of someone like that, isn't it? I expect you've seen, unfortunately, many women die during your practice, many of whom we wish wouldn't have. I can remember that myself.
Yes.
So where did you go to, after early school, where did you go to the university?
I went to Hunter College because my mother had moved from Mississippi to New Jersey, New York area. And when I graduated from Hunter, I went to Howard University. But I went to Howard University because I couldn't get into medical school. And I felt maybe the best thing to do was to get a job down there in clinical chemistry. And as the fellows got to know me better, they would know that I'd make a good doctor and they'd let me in. Little did I know that they didn't want women in medicine in 1950. So I worked at Howard University until 54. And I took the MCATs every year, and I fortunately worked with Dr. Hardy, who was taking care of the tuberculosis people at the time. We had a tuberculosis hospital at Howard. And I helped him to do some of his clinical work. And at the end of the year or 2 years or whatever, he said, you know, you do pretty good work. Why aren't you, you know, interested in going into medicine? I said, I've been trying, you know, since 1950. He said, well, I'll have to look into that. And the next year, guess what? I was admitted to Howard University in 1954 and graduated in 1958.
While you were in the university, why did you decide to go into obstetrics and gynecology?
There, I knew I was going to forget this lady's name, but she worked in Mexico for a very long time. And she left Mexico and came to teach us at Howard University. And I can see her as plain as I can see Dr. Lawrence over there, and cannot remember her name, but she was ideal. I mean, she was just the person that would drive you back to the community to do the things that you needed to do. So I decided that, you know, it wasn't so bad. It was a nice, normal type of relationship that you form with people, and that it was probably a good thing to do. And so that's what I did.
Where did you take your residency?
I did my residency at Kings County Hospital in Brooklyn with Dr. Lewis Hellman. And it was strange because when I took the residency with Dr. Hellman, poor thing, he was being accused of never having taken any black residents into his program and no women into his program. And so I felt a little sorry for him, but you know, he was a big fella. He really could take care of himself. And when I got there, I found out that Randy Bloomfield, who I looked like a football player and I thought was probably Jewish, was a big black fellow. And he was my second or third year resident. So Dr. Hellman had always been taking colored, as we called ourselves in those days, residents. And then I was colored. And then we had a Filipino lady, Zaida Chapeco. And he had admitted her the year before. So we had a pretty good time when we were there at the county.
That was a rather busy time at Kings County. A lot of deliveries and a lot of problems.
A lot of problems. And I can remember one of the problems was we were not allowed to teach our patients anything about birth control or family planning. And we could select or elect whether or not we wanted to go to a Planned Parenthood group in order to work in the community in order to get a lot of our Planned Parenthood education, whether it be just adolescents, whether it be teaching them how to use diaphragms, which was the thing that Dr. Hellman sent us for, because he was determined that every person that delivered at the county was going to know how to use a diaphragm. And so that got to be my thing to do, you know, to Zaida and I, and of course the fellows too, because they didn't have a choice. They may have thought they had a choice, but they didn't. But and Dr. Mary Lane was then in Planned Parenthood, and she was at the Bedford-Stuyvesant, which is in Brooklyn, Planned Parenthood clinic, and that's where I worked for about 6 months. And then during the summer, or if I had vacation or something, he'd allow us to go on over there and work. So I got a lot of good training.
After you finished your residency, where did you go next?
I had applied in Mississippi for a scholarship before I got into Howard University. And one of the requirements of that scholarship was that when you finished your internship or residency, you would go back to a community of less than 10,000 and practice, because they needed general practitioners. They didn't need specialists. And so I went back home, and my grandmother said, well, you ought to work here in Jackson, but Jackson had more than 20,000 people, so I couldn't work there. So I worked at a place called Greenwood, Mississippi, and as the crow flies, as we used to say, it's about 100 miles northeast. And there was a gentleman there, Dr. George Lane, who had been working there. He went the same way I did. He got his education by borrowing money from the state. And then he worked there for probably 10, 15 years and decided that he wanted to go do cardiology. And so he went to Milwaukee, and he left his office in June, and in July I walked into his office. And so I had practice right there, and he left his nurse and his secretary. And so all we had to do was go to work, and we had to convince people that I wasn't too young to be practicing medicine, because I looked a bit young when I finished. And a lot of the little old ladies would say, well, you look just about like my grandbaby. I don't know if I want you to treat me. But I got along well with them, and we treated their high blood and their sugar diabetes. And
Well, tell me about the type of patients you saw during this early phase.
During that phase, we saw everybody. As a GP, you saw pediatricians, and I stayed 6 extra months at the county to do urology, not urology, so that I would know how to catheterize a male that was in urinary incontinence. If I had to catheterize someone, or if I had to go out to a home and find out that that's what was going on, then but I spent 6 months extra, and then of course I saw pediatrics. And people always came to your house because the children always got sick after they got home. And so you had to treat kids for tonsillitis and earaches and things like that.
Did you do much obstetrics during that period of time?
During that period of time, the health department called me and told me that they had several granny midwives, but they didn't have any doctors who were willing to supervise what they did or have classes so as to teach them how to do certain things. And I remember writing to Dr. Hellman and saying, I'm teaching these ladies how to tear strips of sheets and roll them up and put them in the oven so that they sterilize them, so that when they have to tie the umbilical cord, they've got something. So I said, would you do me a favor and send me some umbilical tapes? And so they would send me what I call my care packages. At the time, of course, if I needed other medicines, because you carried your medicines around in your bag, and if you needed tetracycline, we were treating urinary tract for, so that if I had a patient that had a urinary tract infection at that particular time, of course, later we found out that we shouldn't, and so we stopped. But yes, we could give them an injection, and then we'd give them a prescription. Now, many of the people couldn't afford even the prescription, so all they really got was the medication that you gave them if you went out. And they had a temperature of 102 or 3, and you tell the family how to cool them off, and they'd be about 6 months pregnant. But the granny didn't realize that pain in the back was not really the uterine contractions, and so she would stay there usually 2 or 3 hours trying to figure out what was wrong with them, and then she'd call, and of course I'd get in my car and drive out there. But you did house calls. We did home deliveries purely and simply because they couldn't afford to pay $50 for the hospital bill to be delivered in the hospital. And I did have hospital privileges, which I was very happy to have. And the hospitals were segregated so that there was a colored section so that I could admit my patients to the colored section. I had stayed at the county long enough to do tubables, D's and C's, and sections. So Dr. Hellman wrote a letter to the hospital and let them know that I was competent in those areas. And it wasn't that they didn't trust him, but for about 6 months they appointed a mentor, so that if I were going to do a section, I'd call Dr. Jones W. Lamb. He was a doll. And he would meet me at the hospital, and we'd talk about the case, and he was a surgeon. And he'd say, yep, she does need to have a section, so why don't we get on about it? And sure enough, we'd go ahead on and do the section. And he'd go home, and he'd make rounds the next morning. Most of the time, I would have been there before he was, but we got to be good friends. And my grandmother lived, as I say, in Jackson. So when I got ready to go to Jackson, I would always ask him if he would sort of cover my practice, so that if somebody went into labor, and if they were going to the hospital, they would go on out to the hospital and he would deliver them.
Did you yourself do home deliveries?
Yes. And the health department had special rules and regulations as to what you should have in your bag. And of course I knew what to have in my bag, but that was neither here nor there. And when a patient said that she wanted to have a home delivery, then I would try to prepare her home, because I'd go out to the home to make sure that there was newspaper, or that we had plastic, or that we had something that I would want her to have, so that you know, things would be. And I had gloves, because Dr. Hellman sent me gloves in my care package. And so we had gloves, and we had tape, and we took care of the little baby. And even when we got the little plastic things, they sent me those, so that I was taking. I told him that I was working in a third world country, and so he had to take care of me in that third world, since he prepared me to do that, and he did.
How long?
He was wonderful.
Yes, he was a wonderful man. How long did you stay there?
4 years, at which time I decided that I really wanted to finish my residency. So I called him and asked if I could come back into the program using part of my general practice, as maybe a year or two. And he said he'd have to ask Dr. Randall. Clyde Randall?
Yes.
And so soon I got a letter from Dr. Randall stating that I could go back and I'd work 3 years, and that they would allow me to substitute the 4 years of practice for pathology and clinic. And when I got back to the county, I made arrangements with a friend of mine who worked at the Institutes of Pathology, and he was a pathologist, to sort of tutor me on what I needed to know about pathology. And I did not do the clinics. Dr. Hall had our clinics, and every once in a while he has asked me to come over, and of course you went where Dr. Hall asked you to go rather. Because he also was, he was one of the best teachers that we had. Was it G. Edward Hall, or Edward G.
I think
Hall?
that's,
Yes.
And after you finished that part of your training, what did you do?
There was a fella up at Tufts whose name is Jack Geiger, who had worked in Africa and had seen some community type centers over there that thought they could work in the Mississippi Delta very well. And he was up at Tufts with Dr. Count Gibson in the Department of Preventive Medicine. And since he knew I had been to Mississippi, he thought, well, maybe I wouldn't mind going back and helping them to set up a maternal child health division at Mount Bayou, which was the first rural community health center in this country, and that was in 1967, 68, 60, probably 67, 68. And I said, well, you build a clinic and send for me, because I'm not coming to Mississippi and work again like I worked in the past. And there were 2 nurse midwives These were certified nurse midwives, Sister Mary Stella, and the other one was trained in Sweden, Asa Johansson. And so once I got there, they had already set up clinics, and they were doing home visits and taking care of small babies, and then we set up our maternal child health clinic. And I was there probably a year and a half or two when Henry Theed and I met at a meeting here in Washington. And Henry asked if I'd come down and look at a job at the university. And I said, Dr. Theed, the people in the university are mean-spirited. And I don't work with mean-spirited people. So he said, well, I'm not mean-spirited, and my door stays open. And if you'll come and work with us and help us to set up our maternal child health program and our family planning program, because the government was getting into the family planning business then. He said, you would do well, here, and you will help the community, because I noticed how you work out at Mount Bayou. So in October 1969, I joined Henry at the University of Mississippi Medical Center.
How did that fit into your expectations?
Well, it didn't really fit into my expectations because I was very suspicious. And there was the town gown rift, if you've ever lived in a little country town, or where there are physicians in the community and the university. For some reason or other, the university always thinks that they know more and they do better, and so they sort of treat you just maybe a little bit badly. I don't know what they do, but anyway, I thought I would just wait and see, because this is what grandmother always said: don't listen to what other people say. You make your own opinions. You associate with people, you go places, you do things, and you make up your own opinion. And so you're right, after about 6 months, I scratched my head and I thought, well, I don't know why you took so long, because this is not a bad job. In fact, this is the place you ought to be. And so then we began to actually take our community services and our nurse midwifery and our family planning out into the communities and work with the people in the different counties, because they couldn't come to us. They didn't have the transportation, they didn't have the monies, and so we made an arrangement with the health department, the state board of health, and they had 81 health counties, and so if we could go into one of those counties, work with their nurses, take our nurses with us, well, we had a very, very, very good setup, and we would go as far as it's about 130 miles, Greenville, which is over by the Mississippi River. And of course, we were in Mississippi. We were sort of central, and so we would go up probably 100 miles, and then we would go west to the Mississippi, and we would go to the Washington County Health Department. We'd get there in the morning. Henry and Don Sherline did the OB, and my nurse midwives and I would help with because once they knew we were coming, the ladies would come. Build it and they will come. And that did happen.
What was your biggest difficulty during that period of time?
I would think learning how to accept the fact that you belonged to a scientific organization, because you had to belong to the Delta Medical Society, which was your local medical society. And I had written to the American Medical Association to sort of find out if there was some way they could help me in knowing what I could do to I don't know, to make things work better together. But it just didn't appear that there was any way other than, you know, you follow the rules and everything is going to be all right. And I follow rules pretty well. I didn't as a youngster, but as an adult, I follow them pretty well. And you could go to the scientific portions of the meetings, but you were not allowed to go to the social portions of the meeting because the doctors brought their wives, and in the South you just didn't associate with the white families at all. So I would go to the Delta Medical Society scientific meetings, and we had good meetings because they had invited people from University of Tennessee, or they'd come from the university. So they had good meetings, and they would last about an hour, maybe an hour and a half, and then I'd get in my car and drive on back to Greenwood.
Given what you know now, what changes would you have made in your life?
Oh, none.
None?
No. My grandmother was a hard taskmaster, and I followed her directions, you know, and her philosophy always was that if somebody else can do it, you can do it. And if you say you want to be a doctor, then have at it, because you can do it.
There are a lot of young women today that are looking forward to it. What advice would you have to a young physician entering our specialty today, especially a young black physician?
First of all, I think that you have to really want to be a physician. And there are a lot of people that I don't really think know what it means to be a physician. The give and take, the relationships that you build with your patients. And it's totally different from research and the things that you can separate yourself from and go home at night, leave it. You know, if you've got a sick patient, you don't exactly take it home with you, but you do think about that particular patient and how her family does and how you do, and I don't understand right now how our students, because they did me this way before I retired, and I just wouldn't let them do it. They would come and they said at 4 o'clock, they said, "Dr. Barnes, we have to go home." I said, "No, you don't. There are 15 patients sitting out there, and you're going to see those 15 patients before you leave." "Well, but, you know, we're supposed..." There are 15 patients. And we gave those patients appointments in good faith that if they came to see us, we were going to see them. I said, and I'm going to see them right along with you. So if we have to stay here till 5 o'clock, we're going to stay here till 5 o'clock. Now, I don't know that somebody taught me that. I really don't know whether they did or not. But that's the way I am, and that's the way I expect them to be.
The other day we offered scholarships to 4 young African American students going into OBGYN, 3 women and 1 man.
Mm-hmm.
What do you see the future in terms of men and women within your community as to going into OBGYN?
Oh, I used to sit on the admissions committee at the University of Mississippi Medical Center when there weren't any blacks anywhere. And so when I was hired, I was it. I was the female, I was the black, so that I duly constituted any meeting that the university had. And I can remember telling the person that was the head of the admissions committee that I hope I live to see the day when over 50% of the people that we admit into the medical center will be female, because it will be a different practice. It will be a different educational experience, and I believe that.
And that is what is happening. Dr. Barnes, it has been a real pleasure to talk to you. If we weren't restricted by time, I'd stay here for another half hour. It's been wonderful. I can't thank you enough for your willingness to share your experiences with our Video History Project.
Well, you're more than welcome.
Thank you very much.